How to complete the abdomen assessment. As always, we introduce ourselves after we knock on the door and we explain what we're getting ready to do. We're focusing on the abdomen. Again, if any of these things are included in your basic bedside assessment, you do not have to do them twice, just making sure that they are getting done. But to focus on the abdomen, we need to inspect it. What is the contour? What is the size and the symmetry? And if you look in your abdominal presentation, there is a slide that helps show what the contour is. Is it symmetrical from right side to left side? We're wanting to know the condition of the skin. Are there any unusual colorings or lesions on the abdomen? Can we see visible veins on the abdomen? And are there any hernias? Those hernias are going to be a soft, rounded area in just one part of the abdomen. It might be down low by the groin. It might be by the umbilicus or the belly button. It might be literally anywhere on the stomach. Sometimes those hernias can be pushed back in place. We call those reducible. If they're unable to be pushed gently back into place, those are irreducible. Then we need to be sure that we auscultate those vowel sounds. Once again, we're listening for 15 seconds in each quadrant. Excuse me. Make sure that you note the intensity, the pitch, and the frequency of those vowel sounds. Then we're going to palpate the abdomen. Now, I want to be sure and stress that you need to auscultate prior to palpation. If you palpate first, you can actually change abdominal sounds. So always auscultate first. You're going to put one finger or one hand on top of the other, and you're going to gently push down approximately half an inch, and you're going to kind of roll your hand across the abdomen. You want to always determine, are they having pain? If they're having pain, that is the last quadrant that you will palpate. So you start in the adjacent quadrant and then you work your way around clockwise, making sure that you don't forget any area. If the client reports pain when you're palpating, stop. Do not continue palpating. If we were to continue palpating, we could potentially cause damage to the client. We as nurses do not continue to palpate if the client reports pain once we start. Then we complete our closure. We're asking if the client has any questions. Is there anything that we can get for them? Making sure that the bed is in the low position, bedside table is within reach, call light is within reach, and upper rails are up if necessary.